Hello and welcome to the Native Connections webinar, Policies and Procedures, Promoting Coordination Across Youth Serving Agencies. We'll start in just a moment, but first we'll review some housekeeping items. Please add your full name to the participant list on the left by using the drop-down menu in the upper right-hand corner of the attendee box. That will open a small menu where you can choose Edit My Info to enter your first and last name and your program name. All phone lines will be muted, but we encourage you to use the chat box for questions or comments. At the end of the webinar, we'll have a question and answer session to respond to these comments. My name is B.C. Echohawk, and this is the SAMHSA Native Connections Grantee webinar. Along with the Native Connections team and our SAMHSA Contracting Officer representatives, Maureen Madison and Jan Dunbar Cooper, we thank you all for joining us today. As I mentioned earlier, today's topic is Strategic Action Plan Implementation Part 3, Policies and Procedures, Promoting Coordination Across Youth Serving Agencies. We have several speakers today, and it's my pleasure to introduce our leader, John Bird. John is one of our Native Connections Grantee Technical Assistants. Joining him is Joe Lewis, also with the Native Connections program. And today's panelists will include Daisy Spicer, Project Coordinator for the Osage Nation, Jazmin Desiderio, Project Director for the Thoreau Community, Lula Mariano, Community Health Outreach with the Navajo Technical University, and Chrissy Petro, Project Coordinator for the Muckleshoot Tribal School. Opening us up in a good way today is Dave Braveheart, another member of our Native Connections team and a Grantee Technical Assistant. Thank you for joining us, Dave.
Thank you so much, Dave, for opening our webinar in a great way. I want to introduce myself. My name is Joe Lewis, and I'll be going over the learning objectives today. This is the third part of the SAP implementation series on the topic of policies, procedures, and protocols, and specifically the 3Ps toolkit, which was sent out to all of you prior to the webinar. So today's learning objectives for the webinar are going to examine Chapter 2 of the Procedure, Protocols, and Policies Toolkit as related to promoting coordination across youth-serving agencies, including review of example, template, and models. Another learning objective is going to be learn about the safety net procedure protocols, memorandum of understanding, formal agreements, warm handoff, school safety planning for suicide and substance misuse prevention. Going to discuss the applicability and utility of Chapter 2 for the local prevention efforts and encourage peer sharing for procedures, protocols, and policies to promote the coordination. So I'm going to turn this over to John Bird, who's going to give you an overview on the Native Connection approach and how the webinar topic falls on this graphic. John?
All right. Thank you, Joe. Good morning, everyone. My name is John Bird. My Blackfoot name is Elkchild. I was born and raised on the Blackfeet Nation in Montana, and I currently live in Tucson, Arizona. I'm a GTA that works on the Native Connections project. So I just wanted to take a minute, real quick minute, to review the Native Connections approach. Those of you that have been with the Native Connections project for a while, you've taken a look at this and you're beginning to kind of internalize it. But some of the people on the webinar might be new to Native Connections. They might be from one of the newly funded cohorts. So I just want to cover this really quickly, starting with the area in gold. This is where we start. You know, what people begin, first of all, identify their strengths and also identify the resources that they have in the community. They begin to conduct the community readiness assessment to look at what is the readiness of the community to deal with this issue of suicide. And so that when we get around to the next part where we're developing this strategic action plan, we're matching our strategies that we put in the plan to community readiness. I'm sure that we've all had experiences where we've went over the head of the people that we're working with and maybe tried to implement a strategy that they just weren't ready for. And so the community readiness model is meant to help us to kind of keep our finger on the pulse of where the community is so that we can design our strategies to meet their readiness level. So that's the part in the red there on the model. And then as you move around, and the third part, the black part, the projects develop strategic action plans that are based on the readiness of the community. They're also based on the resources that they have in the community and what they want to accomplish with the project. And so the goals and objectives, activities, timelines, etc. And then the last part of the circle, the model, the Native Connections approach is once you implement, you begin to implement your strategic action plan. You look at measuring that plan and long-term planning. You begin to kind of really get into the implementation part of the approach. So I just wanted to take a minute to walk through that. For those of you that are new to it, you'll become more and more familiar with it as we work to plan these projects and implement the projects. So this next slide, this webinar, like Joe said, is a part of the procedure, protocol, and policy toolkit that was developed. And so we're doing this series of webinars, and like Joe said, this is the third in the series. And the series of webinars is really to help you to understand what's in the procedure, protocol, and policies, what we call the 3 Ps toolkit. And so they're all based on these three terms: procedure, protocol, and policy. And I have to tell you that just working on this part of the project, and kind of digging into these definitions and things has been a learning experience for me as well. I always kind of knew that these terms were related, but I kind of used them interchangeably. But, I discovered that in a lot of ways I was using these terms wrong sometimes. So procedures are things that are step-by-step instructions, that outline what should happen. And they usually live within one agency or within one department, and they say, if this happens, this is what we're going to do. If you extend that out and you partner with other agencies and other departments, and you're all implementing that same procedure, then it becomes a protocol. A protocol is something that's usually formal, and it's between two or more parties, where a procedure is usually just, in our organization or in our department. A protocol is where you're beginning to extend that out to partners, whether they be other departments or other agencies, and they involve everybody that's involved in the task, and it includes, similar to procedures, a list of rules that regard the actions. When this happens, this is what we'll do. A policy is more high level. So one way to look at this is procedures is kind of the more smaller level. You're looking at just within your agency or department. Protocol is looking at what you're doing with other partners. A policy is even more high level than that. It might be something that's adopted by a governing body, a tribal council, a board of directors, or an agency. And it does the same thing. It provides guidelines and protocols and procedures that achieve agreed upon outcomes. So let's take a look at these a little bit closer. This is an example of a procedure. The procedure for how we're going to record what goes on in our advisory board meetings, and what we're going to do with who's going to take notes, and how, what we're going to do with those notes. So that's a very kind of internal kind of an example, and so that would be a procedure. But a protocol is a step-by-step process, an agreement between two or more parties. So in this example, a youth is being released from juvenile detention, so the detention officer notifies the Native Connections Program. The Native Connections Program contacts the family and contacts the resources that are available, might be the school counselor, but that's just an example of how we're going to support people when they're being released from juvenile detention, when they're coming back from treatment, when they're having a mental health crisis. So there's protocols for all of these different things that happen, so that when they happen, not if they happen, but when they happen, we'll all be on the same page and we'll know what to do. A policy example is that all tribal programs will collaborate on offering prevention, intervention, and post-vention services. And so that really sounds like an actual policy that's implemented by a tribal council. And tribal councils have authority over all tribal programs, and so they can establish policies like this. But the policy helps to provide guidance, minimize risks, maintain compliance, and encourage success. So I just wanted to run through that really quickly about the differences between protocols, policies, and the other P, which kind of slips my mind at the moment. But so I just want to take a minute to kind of give an overview of what's in Chapter 2. Chapter 2 has 4 different pieces to it. The first one that we're going to talk about is safety net, safety net protocols. The second one is going to be memorandums of understanding. The third section is going to focus on warm handoff, and the fourth section is going to focus on school safety plan. So when we're thinking about safety net protocol, usually, we take all of the resources that we have, we decide how we want to use those resources. If there's some sort of a crisis that happens, some sort of a something that happens, what are we going to do? And so usually it's something that looks like a decision tree, and it's something that you helps you to decide what to do. In this case, you do that. In this case, you do that. So safety net protocols are developed by using a mapping tool. Many of you, cohort 2 and beyond, have done the CSA, the Community Systems Analysis, which really helps you to look at, all of the resources, the programs that you have in the community, the other kinds of the human resources, the kind of physical space resources, and how you would use those resources in the event of needing to help somebody. Cohort 1 projects use the service system inventory, the service delivery system. So there's a couple of different ways that you can do that. You might develop a work group or a coalition that can begin developing or updating comprehensive policies. I'm working with one of my grantees right now that, when I started talking to them about a safety net protocol in their community so that everybody would understand what to do in the event of a crisis, whether it be a mental health crisis or a suicide crisis, what they told me was that they had numerous protocols that lived within different agencies. And so as we discussed that, what they come to realize is that what they needed to do was to bring all of those agencies that had different protocols together and kind of develop a more comprehensive policy that would fit their whole community. So that's kind of the work that they're doing now. What are some of the most effective ways and best practices to follow? Consistent and ongoing updates to the protocol to make sure that it's updated. New programs emerge. Sometimes programs go away. There's a constant changeover in staff and things like that. So all of those things need to be kept up to date, because you don't want to get in a situation where you have a crisis and you need to contact people, but your list is outdated. Your protocol is outdated. So regularly reviewing those, make sure that everybody understands what's on those, and and keep revisiting that. Identify areas for improvement, and just things like that. So this is an example of a safety net protocol example, a decision tree. And I would imagine that a lot of you, when you develop your crisis response efforts and things like that, you're going to have something that might look like this. So you have it begins with a referral source. So maybe you get referred a youth, and this youth is in crisis. And so you do the things at the top. You can talk to the youth. You can talk to somebody else besides the youth, or you can do nothing. And these are the things that happen, and it just kind of guides you in what to do and what to respond. And these are great because everybody can understand this and use that to implement in the case of a crisis. I was working with another community a couple of years ago, during the time that I was there, one time I was there for a site visit, and they had a suicide completion at the high school. And one of the things that they discovered was that people didn't know what to do. And the description that they gave me was that that people were running around like chickens with their heads cut off, trying to figure out what to do, how to support the students, how to prevent contagion, how to support the family, the staff, all of that. And so, ideally, a safety net protocol should include all of that, all of the things that need to be considered when a crisis occurs. So I'm going to turn it over to Joe for this polling question.
Thank you, John. All right, so we're going to have an interactive polling question. So as you can see, there's going to be the where you can click on the question is, does your Native Connection program have one or more safety nets or decision trees? So if you would click one of those, we're starting to get the polls now. We have 1% in so far. So one of the grantees. Now we have 2. And what I'm going to ask also those that have answered yes, if you'd be willing to share with other grantees the template or safety net or decision tree you have. And if you would be able to share, could you just put your contact information in the chat box? And one suggestion that come up in the chat box was they cannot answer no on this polling question. So maybe if you write down in the chat box, know that you don't have a safety net or decision tree, then that will help us know those that don't have that. So yeah, go ahead and just do no in the chat box. We have one that came in, super helpful. We have other attendees that are chatting in now. John, any examples of decision trees that you have with other programs?
Yeah, one of my grantees that I'm working with, they developed a safety net protocol last year, and they're a cohort 1 grantee, and so last year they were in year 4 of their project, and they had one of their staff who really took that on and brought all of the partners and the collaborators and brought all the resources together, and they developed their safety net protocol. And it looked very much like this. It was a decision tree, in the event that this happens, then these things happen. So
Great.
now they're kind of in the process of getting it approved by the tribal council and being able to implement it in the community.
Excellent. And then we got Daisy, who's going to go further into detail on her presentation. She'll be talking.
All right.
And let's see. So we have, so for those who answered no, so now we have that up there. Please share about whether or not this could be helpful. So we have 15 that have answered no. We have 6 that have safety nets or decision trees already in existence. And the other one was for those who answered yes, please share more with the group. So that would be down in the chat box where you'd share more. And we have Chanel Cook, yes. Oh, it disappeared. Elizabeth wrote a rough draft last year, so we're starting to get some comments coming in, but no legal document, or no legal department didn't like that. I wanted signatures.
Hey, Joe, one of the things I'd like
Yes.
to add here is that, you know, there are more projects that have not started developing a safety net protocol, but there are a number that have. And, you know, like I was saying, the Cohort 1 projects, this is their 5th year in the project, and so many of them have developed these. And in my experience with Native Connections, you know, projects really don't get into, they don't mature enough to really do this until year 3 or year 4 of their grant. So I just want you to know that if you haven't gotten to this yet, you know, some of you may still be in year 1 or year 2 and you haven't really got a good start on this yet. You know, it's not anything to worry about, but you want to be thinking about doing this and how you're going to do this. And one of the ways that the GTAs can help is we have access to some of the protocols that have been created, and we can help you to network with projects that have already created them, in that you don't have to recreate the wheel. And so we can help provide examples and things like that.
Excellent. Thanks, John. So we're going to go ahead and wrap this section up, and we'll pass it back on to John. But so we'll relook at the chat box later to see if anyone would like to share examples they have with the other attendees and grantees with Native Connections. So I'm going to pass it back over to John, and this is going to end our polling question. All right, thank you. John?
All right, thanks, Joe. I just wanted to cover another piece of the safety net protocol, and that's a piece about surveillance. And so many of you are probably thinking about surveillance, you know, and how can you set up systems that constantly feed data back into your project. And so one of the things that you want to do is to identify the local community indicators for surveillance. Those are the areas or the opportunities that are within your protocols or within your process there where you can collect data. So some of the ways that you might collect data might be number of referrals to mental health resources, screening data, treatment, admission data, law enforcement dispatch calls. I know that a number of the projects that I'm working with, you know, they're working really closely with law enforcement because, you know, law enforcement responds to a lot of these 911 calls that come in about suicide, whether it's ideation, whether it's about an attempt or a completion or another kind of mental health crisis. So local community indicators can help show the need for, you know, this is the scope of the problem, that we need to develop protocols, that, you know, we have to have resource materials, policy changes that include education and staff training and parent training and things like that, or more outreach in prevention activities. So I wanted to show you this. This is the same decision tree that we looked at previously, but this tree kind of highlights some of the opportunities to collect data. The opportunities for some of the local community indicators are. And so you can see that yourself, you know, that, you know, the police is definitely one of them, but it might be the coroner, it might be a behavioral health agency. So, you know, just some of the, when you get your decision tree developed or your safety net protocol, you know, to look at, you know, where are the areas within that process that you can set up to gather data, that the data will constantly be flowing back into your community, otherwise known as surveillance. So I want to take this opportunity to introduce Daisy Spicer. Daisy is the coordinator, the project coordinator of the Osage Nation in Oklahoma, their Native Connections project. And Osage is a cohort 1 project, and so they're in the 5th year of their project. And Daisy has been the project coordinator there since the beginning. So we'd like to ask Daisy just to talk a little bit about some of these questions that are off to the left in terms of safety nets and local community indicators. What kinds of partnerships have you established to ensure regular access to data? What challenges have you had in developing those partnerships? How do you utilize your data, and how do you share or communicate that data with your stakeholders? So I'm going to turn it over to Daisy. Daisy, please.
Thank you, John, and hello everyone. Good afternoon. Again, my name is Daisy Spicer. I'm the project coordinator at Osage Nation, and we are located in northeastern Oklahoma, and we are located in Osage County of Oklahoma, which is our service area and our reservation, and it is also the largest county in Oklahoma. And I wanted to also say before I get started, we are a cohort 1 grantee, and so we're in the middle. We're towards the end of year 5 now. We're ending our first round of this project, fixing to begin our second. But I'm really happy to see this information being given to grantees all kind of in one spot, in one document, because I can remember in the beginning I would get bits and pieces from this person and that person, and so it's great to see all of this coming together in one guide and in one location, and so good job on that. And so Osage County, we are the largest county in Oklahoma. So in the beginning, we kind of thought that, we would do an overall community, we would have just a protocol overall in our community, and we found out pretty quickly that that wasn't going to happen because there were so many issues of jurisdiction and communities within communities, and it was just really tough to get something like that in place. And so based on our readiness assessments and the different data that we had gathered, we decided that we were going to focus on school districts. There are actually 12 different school districts in our service area, and so we decided we were going to use our project to focus on creating policy and protocols and procedures within the school districts, and for them to have partnerships with agencies outside of the school district and bringing in community resources. We also realized quickly that, as most of you probably can see, there was no local surveillance happening. So the data that we have was, we relied on state data or national data, so we didn't get that until a year or two down the road, and then we'd find out, oh, there were this many people that died by suicide in our county. Also, that didn't tell us exactly where those people were from. Our county being the largest county, we're very spread out, very rural. We have lots of different communities within this county. We didn't know exactly where those incidents were happening. And so some of the partnerships that we've created throughout our project is with local school districts. And we have helped local school districts to create crisis response teams and crisis plans and safety nets. And we are a part of each of their safety nets. We're a part of each of their decision trees. We're a part of each of their crisis plans. And so we have a seat each of those school protocols, and when things go wrong, they call on us or they bring us to the table to help them through that. Also, law enforcement has been a great partnership to get data because they're our first response here for anything suicide related. We don't have a local crisis response team that responds to a crisis where it's happening. We have resources that follow up and treatment for after the fact, but our law enforcement, they are the response team. And so we've created some different processes for gathering data with them, and also our tribal clinic, getting information about referrals and finding out where those referrals are coming from so that we can reach out to other sources and get more referrals from other places. Some of the biggest challenges that we've had as far as school districts are staff turnover, because whenever there's new staff each year, we kind of have to start back at square one, and so that has been a challenge, and we're still working through that. We use our data, a big part of our data to raise our community readiness. We know that our community has a low readiness, and they don't know that things are happening. They don't know that how bad the situation is here, and so. And this goes right into question 4. Because we have a low readiness, we really try to focus in on one-on-one conversations and finding groups to talk to, finding people who will listen to us so that we can share that information. And also with our leadership, bringing this information and the data that we've collected to leadership to get more support from our tribal leadership, which we hope for more funding to sustain the efforts that we're doing within this project and to sustain them once the project ends. So I think that I'm just a little over my 5 minutes now, so I will pass it on to the next presenter. And again, thank you for having me. And if anybody wants my contact information, I'll put it in the chat box, and you can email me, call me, and I'll answer any questions that I can.
Awesome. Thank you, Daisy. So we're going to move into the next section of Chapter 2, which is MOUs, or Memorandums of Understanding. And so I am going to turn it over to Joe again. Joe.
Thank you, John. So let me get this next slide up. So, okay, you got it. So
Yeah.
Memorandum of Understanding. So Memorandum of Understanding is a type of protocol because it takes place between 2 separate entities. So using an MOU is something is important that you can use with different programs you want to work with to be able to develop your policies and procedures, for them to have this agreement between each other on what it is your overall goal is to establish with the protocols and procedures and policies that you want to develop. Now, another one is also the Memorandum of Agreement, which is a written document that includes basically the same thing as a MOU, but it has a financial agreement between the 2 agencies. So if there's financial involvement to be able to establish your goal that you want done, then it will be written in the MOA on each of the entities in what they're going to be covering financially for it to be completed. And so, like, if you do use these, this is going to help you to be able to establish your goal and be able to have written documents for you to work even with your advisory board and tribal government and different programs throughout your community. So next, I'm going to turn this over to John, who's going to run over an example of a template on an MOU and sort of walk you through on what you'll need to be able to use this within your other programs and other entities within your community. John?
All right. Thank you, Joe. And I'd just like to point out that this example is on page 22 and 23 of the 3Ps Toolkit. if any of you need that toolkit, it is in the download box at the bottom right, and you can click on that. You can also download the PowerPoint and Chapter 2 of the policy toolkit there. Your GTA can also send you the toolkit if you don't have it. So we really want you to be familiar with and to utilize this resource. But memorandums of understanding, as Joe was saying, are agreements between two agencies, and they generally have, you know, these different parts. You know, what's the background of this? Why is this important? Why are we doing this partnership? What's the purpose of the MOU? What are the goals? Who's going to do what? Things like that. How is reporting going to happen? How is it going to be evaluated? How are we going to know if this MOU is working? And is there any funding attached to this MOU? Like Joe was saying, if there is funding, that kind of makes it an MOA, a Memorandum of Agreement. Memorandums of Understanding usually don't have a commitment of funds that go along with them. And then another important part is that, you know, that it describes how long this agreement or this understanding is going to be in effect, and lists the contact information for each of the partners involved in the partnership. So I'm going to introduce Jazmin. Jazmin Desiderio is the project director for the Native Connections project at the Thoreau Community Center. Thoreau is a community on the east side of the Navajo Reservation of the Navajo Nation in New Mexico, located maybe 25 or 30 miles east of Gallup, New Mexico. And so Jazmin has a project there, and we've asked her to talk about some of the things around MOUs that she's experienced, why it's important to have MOUs with your school-based partners, what kinds of challenges and what kinds of successes has she experienced in doing MOUs. So I'm going to turn it over to Jazmin.
Thank you, John. Hello, everybody. Good afternoon. My name is Jazmin Desiderio. I am going to be sharing some information about my experiences in developing MOUs with our local school-based center, which is the Thoreau High School and the Thoreau Middle School. So one of the important reasons that I continually tell myself when I'm developing MOUs is that we're doing this to protect our youth, the students who attend these schools. And a lot of times there have been gaps identified between the school's resources and providing different types of services to the students, especially in times of need and crisis. So the important part of developing the MOU is understanding what that need is, where the gap lies, and how your program would be able to make that, to fill that gap or make that connection to have other resources fill that gap for the students. It's important to understand that the MOU is for both parties or parties invested in the protection and the availability of services and resources for the students or for the youth. Some of the challenges that I've gone through in developing MOUs would be trying to collaborate with the entities involved. Sometimes a lot of them are not available when you're available or your schedules are off, but it's important that everybody works together. And so stakeholders are committed to establishing and developing a formal agreement. So understanding the language can be used in the MOU is very important, which means that it's a formal agreement. So whatever you put in the MOU, the language, you're going to have to understand it because it's going to guide you and your actions as a program to actually basically dictates what you can and cannot do within the school. So it's important to understand what the language that's going to be used in the Memorandum of Understanding. Also, one of the biggest successes and best practices that I've experienced is working together. I've said it might be a challenge when you're trying to get to know the people involved in developing the MOU, but once you've established that strong relationship, it's actually going to be one of the best foundations you'll have, and it'll lead to a success rate after the MOU has been approved. And I do want to stress that the MOU is a safety net, and the partners who work with you in establishing the MOU will actually be there as a reference, and they'll be able to tell you if a problem arises, and if you have the ability within your MOU to make that connection within the school, or if amendments have to be made to the MOU. And one of the biggest things that I'm very thankful for is that our superintendent supports us. So if anything comes up, we're able to call him and ask him, does this fit within our MOU? If not, he'll tell us the steps and the procedures needed to make that amendment. Also, understanding the actual steps to have the MOU approved within your school-based programs is very important, because usually it leads to having it approved by the board members, their legal team, the superintendent, the principals that you're going to be working with in the schools and providing these services to. So it's a long process, but it's worth it. And I do highly suggest, again, that having a strong working relationship with these individuals when developing the MOU, and even after it's approved, will actually lead to great successes. And that's all I have right now. If you have any additional questions, you're free to ask in the chat box, or I'll be here at the end of the presentation. Thank you.
Okay, thank you, Jazmin. We're going to move on to the next section of Chapter 2, and we're not done hearing from Jazmin yet. I'm going to just talk about the next topic a little bit and bring her on again to talk about warm handoffs and how those get handled there in her project. But you know, what is a warm handoff, and how is it related to promoting coordination across youth agencies? So a warm handoff, I really like that last bullet point there. I think it's the most important one, you know, that all of us are concerned about youth falling through the cracks. And there's, as we know, there's lots of opportunities for that to happen. And so having a warm handoff, and handoffs can go, handoff means you get a client, whether it might be a youth that's been referred to you because of suicidal ideation or whatever, and you interview the youth. You're trying to decide what would be best for them, and so you interview them and you talk to them, and then you want to refer the youth to another provider, maybe a behavioral health provider or a psychiatrist, or some other a medical provider or whatever. So a warm handoff really connects your patient or your client to the new provider, and it leaves a minimal amount of opportunity for that youth to fall through the cracks. So the warmest handoff, if you think about it, would be I take the youth and I walk them over, or I transport them over to the next agency, and I turn them over to the next provider. That would be the warmest, kind of a handoff. And you're really assuring that, they're not going to fall through the cracks, but that doesn't always happen. The opportunity's not always there for you to do that. And so, what are other ways that you can think of to keep them from falling through the cracks and have kind of a smooth transition to the next provider? A couple of years ago, I was working on a project here in southern Arizona with one of the big tribes here in the area, and I was interviewing families that have family members with serious mental illness, and they talked a lot about, the difficulty of getting services for their family members when their family members would go in crisis, or they would go off their meds or whatever and kind of create a crisis. in the family or in the household. And so one of the things that they said was that what they disliked the most was when they were trying to find help for their family and they got passed around. They would call it the runaround. You know, they would say, somebody would tell them, well, you need to go over here, and then you need to go over here, and then you need to go over there. They would call it the runaround. And a lot of them would say, you know, when I got the runaround, I would give up. I would quit. You know, I just didn't have the energy to deal with it. I had the energy to, you know, do all of that. And so what we want to do in helping people to not fall through the cracks is how do we make it easiest for them to make the transition to the next provider. So I'm going to ask Jazmin to talk about that again. Oh, just really quickly, here's an example of a warm handoff that you have, and these examples come from your manual. And so in this example, this young man came to see you for behavioral health services. So you kind of assess him and talk with him, and you find out some of the things that's wrong with, you know, some of the information that, you know, the next provider might need. So this is an example of how that happens, and you know, providing that information and referring the patient to the next provider. So I'm going to ask Jazmin to talk about warm handoff again there in her project, you know, why it's important to have a protocol for that, how does it work, what are some of the best practices she might recommend for successful warm handoff where our clients aren't falling through the cracks. Jazmin, please.
Thank you, John. Okay, so warm handoffs. It's important to understand and know the procedures, policies, and protocols that are in place that pertain to warm handoffs for your project or in your community. It connects the patients with the providers. This is especially important if you want to ensure that the patient is receiving follow-up services or services at all. So warm handoff protocols will show the individual that you care and you're going to do everything possible to make sure that they are safe. And that's what it boils down to, is understanding and making sure safety is your number one goal for these individuals. In our community, what we do is we work with different entities, especially the Crisis Response Team for Eastern Navajo Agency. They're a group of individuals that respond in times of crisis or trauma. And what we do is we speak, for me personally as a project director, I speak regularly with these individuals. And we have that working relationship. So if anything happens or is occurring or has not officially gone through the phone tree that we have set up or the policies and protocols, or I'm able to reach out to them and let them know, okay, I have this youth. Oh, what should be our next step? I've already referred them, but it's going to be a couple weeks out. And we set up different type of follow-up options for them. And we have individuals who are trained, or even from the Navajo Nation Behavioral Health, that would be able to step in and start providing services for these individuals before they actually start receiving care. And we do understand that there are some instances where our protocols won't be followed, especially in times of crisis. So we want to make sure that everybody who is involved, all the stakeholders that are invested in warm handoffs or prevention of any kind or providing the services, are prepared in providing and creating that smooth care transition. So we want to make sure that nobody or the youth who need these services fall through the cracks. And that's what we've seen an increase of, because a lot of times there's a high turnover rate with different programs. And these different programs, the new people that step in don't understand that we exist or that there's a policy or protocol, because they're not familiar with the workings of the program. So one of the best practices I recommend is that you build that strong relationship with these programs. So if there is a turnover rate, then you're immediately notified and you're able to build and start building that trust again, and that relationship where you're able to let them know what your program provides and how you're able to be there, and sharing the information from what you and other entities have already established in responding to these type of instances. And one of the biggest things that should be, that I highly recommend, is working with the community. If you invite community members to meetings that you're holding to address or present on your protocols or your policies, or even just a regular meeting with the different types of programs, inviting them will actually give you the opportunity to learn from firsthand from these individuals that may have experienced it themselves and falling through the cracks, and where services were lacking, and how you're able to help them or meet that gap. Because the information is there in your community, and they're willing to share it as long as you invite them. And most importantly, the best thing is when you're working with a lot of other programs, is that success is going to be found in breaking the territorial mindset and working as a team. It's no longer, this is my jurisdiction, that's your jurisdiction, or these are my programs and that's your programs. It's working together collaboratively towards the overall goal, and that's for the safety and safety of the community. And that's all I have. I included my contact information in the chat box, so if you'd like to ask questions or wait until the end of the presentation, I'll be here. Thank you.
All right. Thank you, Jazmin. We are going to move on. We have one final section to cover, and then hopefully we'll have time, to get to some of the questions that are popping up in the chat box. If you have a question for Jazmin or Daisy, please put it in the chat box, and we'll try to get to it after we conclude this next piece. So the final piece of Chapter 2 in the toolkit is the school safety plan. And so we chose to include this resource that's at the bottom of the slide there, Preventing Suicide, a Toolkit for High Schools. This is the California State the California State policy, or the California State model that they put out for all of the schools in California. And what I really like about it is that it's very comprehensive. It covers about 10 pages or so in the toolkit under the school safety plan overview. But school safety plans are really, they're protocols that are designed to help students that might be at risk for suicide attempts. So they include agreements with behavioral health providers and other providers to students. It includes postvention. Postvention is, what do we do in the event of a suicide completion? How do we, and postvention protocols generally have two parts. How do we provide support services to the family and others that are deeply impacted by a suicide completion? How do we do that? And then the other part is how do we prevent that suicide contagion? How do we prevent it from spreading and kind of becoming a cluster? So those are kind of the two pieces of suicide postvention protocols. They might include staff education and training, parent education and training, and student education. How do we educate all of those? So I would really encourage you all to dig into that California model that is in the toolkit. It's a very, here's the examples of the California model that's in the toolkit. It's on pages 32 to 45 in Chapter 2 of the toolkit, but it's very comprehensive. It includes prevention, all of the things that you can do around prevention, all of the pieces that are listed there, messaging about suicide prevention training and education, employee qualifications, specialized staff training. How do we educate and keep in the loop parents, guardians, and caregivers? And how do we include students and educate students as well? Then it includes a section on intervention, assessment, and referral. That includes the staff, parents, guardians, and caregivers, students, parental notification and involvement. You know, what do you do if there's an attempt a suicide attempt in the school? What's the protocol for that? What's the action plan if it happens, if there's a suicide attempt but it happens outside of school? Supporting students with a mental health crisis, reentry to school after a suicide attempt, and responding to a suicide death, otherwise known as postvention. So those are all the pieces that are included in the school safety plan, the comprehensive California school safety plan that's included as an example in your toolkit in Chapter 2. So now we're going to have two presenters on this section. The first one is going to talk about the development of school safety plans from a tribal college perspective. Lula Mariano is the public health coordinator at the Navajo Tech University in Crown Point, New Mexico, and she's had an interesting experience there at Navajo Tech with the development of school safety plans, and so she's going to share that with you. So go ahead, Lula.
Hello, everyone. I am Lula Mariano, and I am the Community Health Outreach for the Navajo Technical University under the Native Connections Grant. And I'm happy to provide some information to you on having a safety plan. And so for a school, college, or a university, a school can be affected when an individual is facing or struggling with a mental health problem. When a student, staff, or faculty is talking about killing themselves, or you have someone who is depressed or under a lot of stress and unable to cope, you want to have a safety plan in place. And so it's very crucial that a basic protocol exists so that there are coordinated efforts that protect the safety and well-being of the individual in crisis and also members of the campus. This protocol will guide team members through the procedures and how to assist to provide assistance to an individual who's having a mental health problem, and also to refer the individual to get help that is needed. And so one of our SAP goals was to look at NTU's mental health crisis protocol, and when I looked into the emergency plan that the university had, I found out that there was not one in place. There were other emergency procedures, like for active shooter or bomb threats, but there was no procedure in place in how to handle a mental health crisis. And so I started working on establishing one with NTU staff and faculty, and there were challenges in the development. So getting a team together, that was easy to do. Identifying team members and getting the team together was easy to do. However, getting the team to commit to establishing a protocol was very challenging. We had 3 good meetings with team members agreeing that there is a need to have a protocol in place. And the team members expressed concerns about, well, how do we handle a mental health crisis? or who is the contact person, or who do we call? Just lots of questions with how do we handle it. And also the team members expressed the need for training. A lot of them were expressing fear because they didn't know how to handle a situation. And one of the team members said, well, I know that if we had a student who attempt a suicide, we will all be running around like chickens with no head because we don't know what to do. And so I scheduled training for the team, and no one showed up for the trainings. And then scheduling meetings again was disappointing and frustrating because no one showed up. And so it just slowly phased out, and it was really frustrating for me. And so all of a sudden we started getting calls on students who were talking about killing themselves. And so people started asking, well, what happened to that team that was working on developing a protocol? And there was talk about how we needed to get back together and work again on establishing the protocol. And so I got the team back together, and we started working on drafting a protocol, and we were successful this time. We now have a written plan in place with a tree mapping, and our protocol includes team members, members who will intervene when there's a call, and then the intervention procedures, referral and follow-up aftercare services for the individual, emergency transportation if the person needs to get to the hospital, who is going to transport, and also training requirements for the team members who are going to be responding. And so our written plan will be reviewed by the cabinet, the board, for approval, and once it's approved, then the protocol will be inserted into the NTU's emergency plan. And so that's where we're at with the development of our protocol. And we did have help from the IHS MSI, the MSPI program, and also the Eastern Navajo Agency's crisis response team. They gave guidance in how to develop our protocol, so I'm really happy and thankful to them. So that's what I have.
John?
Sorry, I was talking away with my phone on mute. Sorry about that. Thank you, Lula, for that perspective from a tribal college, tribal university perspective, the Navajo Tech University. So now we want to hear the same questions addressed by Chrissy Petro. Chrissy is the project director of the Muckleshoot Tribal School, which is a K through 12 tribal school on the Muckleshoot reservation in Western Washington in the Seattle-Tacoma area. So, Chrissy, could you share with us some of your experience and some of your challenges and successes?
Absolutely. Thank you, John. Hello, everyone. It's great to be hearing from other grant project coordinators on what's being done around all of these different communities. So thank you so much for being a part of this. I think, Lula, you did a great job of describing what a school safety plan is. I think I see it very similarly to you, and essentially what has been done in the past has been the intention around a school safety plan is to be proactive, and oftentimes we find that we're just responding, right, and trying to come up with a plan to lessen the effects of a crisis. And so essentially a lot of the school safety plans that have been in effect, at least in my experience here in Washington State, have been primarily around what are policies, procedures, protocols around what to do in the event of a natural disaster or a fire, a school shooting, and only more recently have they been including suicidality. And so what I found, and I just started this position in August this past year and came on board previous to that as a mental health therapist under the Native Connections grant. And so a lot of the work, we're in year 3 of our grant project, and a lot of the work done here so far was done by my predecessor, Peter Simpkins-Fleck, who did a lot of the legwork in trying to coordinate efforts between different departments and figuring out the needs of the community, and especially here at the school. So I think it's really important to have a school safety plan include suicidality, because in the midst of a crisis, it's difficult for all parties to know what to do. We end up going to one person, such as the school counselor, and then recurrence is high when we're not able to get out of like the crisis management or reactionary mode. And so to become proactive, being able to sit down at the table and look at all of these different components that we're talking about today is really important. So a plan can involve prevention, intervention, and postvention. Some challenges that I've encountered have been like just getting to understand the school environment, coming from a mental health background. I've been located in schools before, but not full-time, and being enveloped into a small community like this is a growth experience for me. So trying to learn what the different roles and responsibilities of people not only in the school but in the community at large, which largely revolves around the school here, has been a really great experience to immerse myself in. Another challenge was kind of lack of written policy and procedures in general at the school. So there's been policies and procedures that have mostly been spoken and not necessarily written down, and the tribe has worked really hard over the past few years to start getting written policies and procedures here at the school. And so in this past year, I think they've passed, our Tribal Education Commission has passed close to 15 policies and procedures, and so we're getting there. And another challenge has been interdepartment communication and understanding. Oftentimes I would find myself in meetings like we're saying the same thing but with different languages. And so like for instance, like academic disciplines versus, the like psychology discipline or field that I come from, and just a difference of training across those different disciplines. So we've also had changeover in leadership. So our superintendent, it's his second year here as well. So we're all just trying to get used to what our roles are and trying to figure out what next steps are. So I want to move on to some successes. So we have been able to develop a crisis response plan. That's what we're calling our safety plan around suicide. And it's a pretty thorough one. My predecessor really based it on our Washington State one and then adapted it to fit the community here and used a couple of different models to integrate that. I would say best practices are researching other school district safety plans and policies and procedures around suicide, and really getting others involved and building relationships. So I found that I got on the job and I really wanted to get all of these things done and say, kind of get my point across to a lot of people, and feeling the sense of urgency that I think a lot of us feel, especially after a loss. we had a loss due to suicide right before the school year started this year, and so there was a sense of urgency to get a lot of things done to support the community, to pass some policies, and so I really had to kind of sit back and say this, any of these challenges that I'm facing really are about building relationships and finding out who are those people that are ready to take a step and move forward in developing, and be proactive. So I would also include professional development and training for staff and faculty. We've partnered with other organizations outside the tribe as well. One is Forefront in the Schools, which is a program in University of Washington that specializes in developing suicide prevention programs within the school. So we're completing our second year of a 3-year partnership with them, and it has involved developing this crisis plan and also providing peer-led trainings for parents in the community, for faculty and staff here at the school, and also student-led trainings within the school, which we just had our first one yesterday. So high school student leaders are training their peers in suicide prevention, and using Forefront's model, then the community, the school staff, and the students will be all using the same language around prevention. So it's looking up, and we're really hopeful for how this next year will pan out. Thank you so much.
All right. Thank you, Chrissy. Chrissy, if you could enter your contact information in the chat box, your email, I would imagine that some people might want to take a look at that University of Washington model that you just referenced. And so, yeah, it's really great to be located in an area where there's a major university, or like in California where there's guidance provided by the state. And so a lot of you have resources like that in your area. For some of you that might be in more remote areas, you can certainly access that information and use that information from other areas if you're not getting it from your local area. So I'm going to go ahead and turn it over to Joe for the next couple of slides. We're just going to spend the rest of the time kind of recapping and getting to as many questions as we can. So go ahead, Joe.
Thanks, John. And I'm off mute. So we'll just go over the first one. So what are some best practices discussed today that you can immediately integrate or adopt into your work? And what are some key takeaways from today's webinar? So if you want to just put those in the chat box. I think the next section after we just go over these questions is we're going to open it up for questions. So you'll be able to raise your hand, and Mark will be able to unmute you if you want to ask your question on the phone, or just type it in the box as well. So what are some best practices discussed today that you can immediately integrate or adopt into your work? We have a few people typing. I know with the some of my grantees, and especially the cohort ones, was finding the that decision tree, which is really useful in just seeing what the other programs you're teaming up with, and how you can decide on who is going to do what in the case that there is an attempt or completion. So we have the comment made by John. If you have examples, please raise your hand to share. So John, do you remember the okay, the comment made by John was useful, not useful on accessing services. The MOUs and decision tree. identifying our safety net and community, that is local natural helpers or identified services. It seems there's no resources compatible with remote places. So can you think of anything on that, John? Resources
Yeah,
compatible?
I'd just like to clarify the comment for some of the other grantees. Bernita is the director of the project at Havasupai. The Havasupai tribe lives down in the bottom of the Grand Canyon. The only way to get down there is to either walk or ride a donkey or go on a helicopter. And so they have, they have some issues that are related to remoteness, the remoteness of their project. And so, one of the things that I would like to really work with Bernita around is how to network with some of the other Native Connection grantees in her area. And these are things that she's asking for as well that can really kind of serve as a resource to her. And also accessing a lot of this information that's available over the internet, like the California model or some of the models that we're talking about here on the webinar. That's another thing that it's not a reality yet, but we're talking about it. Is we want to create a portal that would be accessible to all of the grantees where we could store things that would be useful for them. Right now we don't have that, but we're beginning the process of looking at developing that. Just wanted to clarify a little bit of that about some of the things that you can access without that remote communities can access as well. I see some other folks are typing into the chat box. How are all of these protocols and MOUs culturally adapted for tribal communities? Are there things you've done to make these Western processes work better in tribal communities, especially rural ones? Do any of the presenters want to take a stab at that? Daisy or Jazmin? How do you adapt these models for MOUs and protocols to fit your community, to make it more culturally adapted is kind of the question there.
This is Daisy, and I wanted to go ahead and address her first question about encountering any resistance to allowing the community to see our data. And so there's a couple of different angles that came to mind when you asked that question. So resistance from the community itself, maybe a little bit because there is stigma here that we're up against. And that's part of the reason that our readiness score is so low, because people, even with the data, don't fully connect the dots or don't want to admit that there is a problem, or if it's not happening directly to their family, they're not really acknowledging the gist of the problem. But as for leadership, are not really a lot of resistance from leadership when we're able to give them data and information. When we have the data to share, it seems that leadership, tribal leadership, they listen and they appreciate the local data and any stories, even qualitative data that we can offer, stories and examples of incidents that we can talk about and give information of how things happened or how things played out and why we need their support and why we need funding to continue doing what we do. So to answer your question, yes, but it doesn't stop us from continuing to talk and continuing to put the information out there that the resources and the strengths that we do have in our community, and trying to highlight what's available so that people, if they do encounter somebody that is needing help, they know where to go, and they know that we're here, and they know that we're available, and that we care.
Thank you, Daisy. I'd just like to point out this comment that was made by Julia Russ. She says, I believe good communication is truly key. I think she's talking about best practices. Keeping the conversation going, even if it's not, even if people don't feel like it's that important or whatever, or that it's eminent, especially in the school. And you know, I think Lula addressed that too. You know, she was having a hard time getting things going until there was an actual suicide crisis at the school, and then people began to say, you know, what happened to that team that was, you know, working on developing a protocol for this. And so sometimes it does take a disaster or a crisis for that to kind of move that along. I'd just like to, I'd like to say thank you to, you know, for that comment about it. It seems to be in line with other comments that people have made about the importance of relationship building and just keeping the conversation going. One of the things I was going to mention there with Lula, just from me working with her as her GTA, I know that it was really important that she didn't give up on the conversation. She kept talking to people. She didn't, because she became discouraged. I could hear it in her voice and things like that, but she didn't give up, and she kept the conversation going, and eventually, you know, the decision makers came around to her way of thinking that, yes, we really do need to have one of these protocols for our school. So I just wanted to point that out. I think Rufus Spear from the Northern Cheyenne Project in Montana kind of gave a perspective about talking about how to adapt things and make them more cultural. He says that we presented MOAs in a light that reflected how in our culture we're supposed to work together. So when you have historical examples of how the community worked together to bring about change or change a traditional law before the reservation was established, it brings about a greater discussion and also makes it more relatable. And so really working to include those traditional values in the discussion about caring for one another, because you know, our traditional cultures were really good about that. You know, they had a lot of protocols. They might not have been written, but there were a lot of protocols for how we take care of that. And so I really hear Rufus talking about keeping that cultural knowledge at the forefront, and then it gets weaved into the conversation, and it also gets weaved into the products that we produce. So thank you, Rufus, for that. Just maybe one more comment. We have a couple of more minutes. I'd just like to read this one other comment that was made by Chrissy and Lindsay at the Muckleshoot Tribal School. It's often an experience of walking between two worlds. I found that acknowledging this is helpful, that, you know, there's this Western way of doing things, but we also have our traditional knowledge or our traditional way of doing things, and including how the youth are required to walk between two worlds every day. So patience in developing relationships is key. Being patient with folks, you know, and working to educate them about these things is really key. So we are running up against the 90-minute time limit. And I just want to take the last minute here to say thank you to all of you for being here on the webinar. I thought there was some really good participation and some good comments and things that were made. I also want to thank the grantee presenters that came in and agreed to talk to us from the front lines of their projects that they're working in, and talk about some of the things that they're doing in these 4 different areas that are in Chapter 2 of the toolkit. I would like to just end by asking, encouraging people to really dig into that toolkit. I found by preparing for this webinar that there's a lot of really great information in there. And I would say that that's probably true about the other chapters in the toolkit. So I'm going to turn it over to BC, who's going to wrap us up here. Thank you all.
Thank you, John, and thank you everyone for joining us today. Please look forward to our next webinar on June 11th, same time. That will be SAP implementation, part 3 or possibly 4, high-risk youth and transitions into and out of treatment. Also on July 9th, look forward to our session, Strengthening Resilience Through Culture. So thank you again for the good conversation.